Local authorities reviewed declaring COVID-19 as endemic and moving closer to a return to normal life. This would mean further easing of virus measures, including the removal of mandatory quarantine for confirmed patients. Ji-yeon brings the updates.
South Korea reported 43,925 daily new coronavirus cases on Wednesday. The second straight day it stayed above the 40,000 level. Korea Disease Control and Prevention Agency said there were 383 critically ill patients, down 15 from a day earlier. 29 COVID-related deaths were recorded, marking a 0.13% fatality rate. South Korea's daily new infections have been on the downward trend since mid-March after a peak of over 620,000. So the new Yoon Suk-yeol government is trying to push forward toward a return to pre-pandemic normalcy. South Korea eased the country's outdoor mask mandate last Monday and downgraded the virus to a Class 2 infection from Class 1 on March 25th. The Ministry of Health and Welfare said Wednesday it'll discuss next week whether it'll proceed with the government's plans to officially declare the number of coronavirus cases as having plateaued or is in steady decline on May 23rd, indicating COVID-19 has become endemic in the country. One of the conditions is recording fewer than 100,000 daily infections, which would allow the medical system to readily provide treatment for confirmed patients.
During the transition, there will be a complete reorganization of neighborhood hospitals and clinics to enable in-person treatment. The current system is convoluted and ineffective, divided into facilities that provide checkups and those that offer treatment.
During the next 100 days, the ministry will unveil plans to carry out some of the coronavirus response measures released by the President Yoon's Transition Committee last month to prepare for a post-pandemic regime. This includes revamping coronavirus response measures based on scientific evidence, establishing sustainable infectious disease response measures, the protection of vulnerable groups of people in the low-income bracket, and the procurement of safe vaccines and coronavirus treatments. Ji-yeon, Arirang News.